they fall into suspicious that could it be due to some structural problem? Could it be because of tumor? So, if history and examination are sufficient for treatment, you don't need paraclinical procedures. If the diagnosis is obvious clinically, what is obvious clinically? What is clinical diagnosis?
By taking history.
Diagnosis during taking history and examination. Most of the time, depression is a clinical diagnosis. Autism is a clinical diagnosis. ADHD is clinical diagnosis. You can diagnose just by taking history and physical examination. It's not necessary to take imaging and other parameters.
You can discover that the cause of the depression is by tumor only by clinically.
Even when the depression is because of tumor, you have some clues in physical and neurological examination. It's not in your field. But a good neurologist, when the depression is because of tumor, in examination he can find some clue to reach to the diagnosis of it could be due to a structural etiologies. For example, in old patient, I look at the eye by ophthalmoscopy. By ophthalmoscopy, you go through the eye, and if tumor is inside the brain, you have some term, we call it papilledema, some signs that shows that the pressure inside the brain is high. So most of the time, a good history and a good examination can guide you if there is some necessity for taking, for example, I have a patient, the family said that the patient was 55. The patient was very good, but suddenly we saw that he's depressed. Something is happening. How one should be suddenly depressed? And we checked it and it was because of a stroke. See, you should have some knowledge. This is a little complex. For sure, you should be in close connection to a neurologist, to a psychiatrist consultation. So, what time you go through paraclinic? When different diagnosis is not happening by history and physical examination, and the planning and prognosis is important for the treatment. Oh. The 16th question from there.
EEG is primarily used as a functional procedure.
Yeah. EEG just check the function of nervous system, electrochemical activity of nervous system. But MRI check the
Structure.
So we have to, it's different from functional disorder, structural disorder. No. The paraclinic divides to two parts. Some types of paraclinic check the structure. Some types of paraclinic check the function. It doesn't mean that in structural disorders you don't have problem with function. For sure, when you have a structural disease, the function is disturbed. But EEG check the electrochemical activity of nervous system. But MRI, CT scan check the structure.
So the electrochemical reaction is not structural?
Again, it could be due to a structural problem, it could be due to function. For example, when the patient is depressed, but the structure is intact, which means that electrochemical activity in the limbic system is decreased. So the function is disturbed. It's better to say functional disturbance could be due to functional disorder, could be due to a structure. You lose the function. Anyway, in any disease. What is disease? Deviation from normal functioning. This is the definition of disease. But when this deviation from normal functioning is because of destructive and structural problems, we call it structural diseases. But when this deviation from normal functioning, this electrochemical functioning in nervous system, you don't have any structural problem, we call it functional disease. You have just lost the function without structure. But in a structural disorder, you again lose the function. Oh, and the 18th question was there.
A lesion in basal ganglia is mostly likely to produce movement disorders.
Yes, very easy. See, basal nuclei is again for coordination and modulation of the movement. So if anybody asks you, I will review for you the other slide. With this question and with this explanation, we will go very fast tomorrow, the slides, and we will finish them. And if you learn this part, you have learned neurology, because all the nervous system disorders will have some symptoms. Okay. What is motor system we mentioned? Pyramidal system, which consists of primary motor cortex, which goes through the muscle. And midbrain and the spinal cord till muscle. This is pyramidal system. But this pyramidal system again is controlled through balancing system, which includes cerebellum, vestibular system, proprioceptive system, and also basal nuclei, which modulates the movement, control the force, harmony, continuity of the movement. And whenever you have any problem in basal nuclei, we have some problems, we call it movement disorders, including Parkinson's, Huntington's. Okay. The 19th question here. Exactly. Vestibular system is very close to its proprioceptive system. Gives some spatial orientation by, again, internal feedback, and is a part of balance system. So, balance system includes proprioceptive system, vestibular system, and
Proprioception.
okay, and the last question. Okay, these 20 questions